Herkese merhaba arkadaşlar. Ben Jonathan. Bugün sizlere deney yapacağım. Evet. Deneyimiz için gerekenler bir H2O, bir sitrik asit, bir çakmak. Dördüncü element olan tahta da olabilir. Neyse, deneyimize başlayalım. Oğlum ben o suyu içiyorum ya. Kullanayım ben onu ya. Kullanayım dedim bu tuvalette ya. Kullanayım, ne alıyorum onu ya. Lanet olsun babaanne, hayır. Lanet olsun babaanne, hayır. Evet arkadaşlar, gördüğünüz gibi bir babaanne baskınına uğradık. Evet, siz de evde babaannenizle yaşıyorsunuz, bilim adamı olamıyorsunuz. Bunu kanıtlamış olduk. Herkese merhaba arkadaşlar, ben kanalımıza yeni bir video atacaksınız. Bugün sizlerle bir oyun oynayacağız. Zaten gördüğünüz gibi yani çok bu oyun. Bu arada ikinci girişim bu. Az önce girdim ve 3 saat Allah'tan fark etti mi? Yoksa gitti geliyor değil mi? Soru çıkmasın. Tekrar gelmesi herkese merhaba. İkinci girişim gördüğünüz gibi bir oyuna karşınızdayım. Başlayalım oyuna. Bu yüklensin.
Removal. I'm Dr. Jeff, and I will be guiding you through this procedure today. The edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose. Improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain, but remember that you should never attempt to remove an ingrown toenail yourself. If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one. Our patient is ready, so let's begin by disinfecting.
Süper sanatsa.
Several locations around the toe. Great. Now we'll wait a few minutes for the toe to get numb. Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. Once you've done that, first, carefully slide one blade of the nail anvil under the affected nail. We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail. Great. Take the forceps and carefully remove the ingrown nail. It's getting kind of messy in there. Let's clean up that blood. See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe to That toe is starting to look much better, but we're not done yet. Next, we're going to apply some phenyl acid to the wound. This will help ensure that when you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
Görmedim öyle bir şey.
Finish by applying some antibiotic.
Doktor Jeff.
Place it against the toe and wrap it in a gauze bandage. Fantastic job! Since there was some obvious infection, and that's how we remove an ingrown toenail.
Evet arkadaşlar, ben bir tane daha bulup hemen. Evet arkadaşlar, 18,5 hafta.
Welcome to Surgery Squad's Breast Cancer Awareness course. I'm Dr. Susie, and I'll be providing you with vital and potentially life-saving information about breast cancer. For those with there are a variety of breast cancer treatment. Before we move on, take a few minutes to review the various stages of breast cancer using the arrows below.
Vazgeçtim onu görünce. O zaman ben videoyu durdurayım. Evet arkadaşlar, kaldığımız yerden devam ediyoruz. Anestezi yapalım.
Just prior to surgery, additional drops of anesthetic are applied.
Gözüne ne olmuş öyle ya?
We'll use a device called a speculum to hold the eye open wide during the procedure. Place the speculum for me, please. Now that the patient is anesthetized, we insert a syringe into the eye. Now we inject an air bubble into the vitreal fluid. As the bubble expands, it pushes the retina back against the wall of the eye. With the retina back in place, we can now seal the tear using a freezing probe. The probe is touched to the outside of the eye where the tear is. This freezes the tear back in place. It may take several touches depending on the size of the tear. The tear is now repaired. The needle insertion will heal quickly. Can you remove the speculum? Our patient needs someone to drive him home after the surgery, and he shouldn't drive until he regains sight in the eye. We'll prescribe medicated eye drops to use several times each day for a few weeks after the surgery, and he'll need to...
And I'll be helping you with this surgery today. A root canal is an endodontic dental procedure that's used to repair and save a decayed or infected tooth. During a root canal, your dentist or endodontist will remove the pulp tissue within the tooth. Once everything is removed, they'll clean out any contaminants inside the tooth and seal it to prevent any further infection. Our patient today is having a root canal performed on their lower right second. Before we begin, would you like to review some of the common myths and misconceptions? In effort to make our patient as comfortable as possible, we need to inject a local anesthetic into their gum line. But first, apply a topical numbing gel to the injection site. This will help reduce any discomfort the needle. Next, we can inject the local anesthetic. After the local anesthetic has taken effect, the area should become numb for a few hours. Use the syringe to inject the local anesthetic into the patient's gums. Just below the tooth we'll be performing a root canal treatment on. Let's give our patient a few minutes to relax and for their mouth to become completely numb. Now that the patient's mouth is numb, we can move on to isolating the tooth. Since our patient's saliva contains contaminants that we don't want getting into the tooth, isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber dental dam and place it over the tooth. Once the rubber dam is in place, put on a tooth clamp to keep it from moving. Next, we'll need to dry out the tooth as much as possible using our air-water syringe. So far, so good. Now that the tooth has been isolated, we can create our access cavity in the tooth using our drill. The next step is to clean and shape the tooth's canal using a root canal file. Go ahead and give it a shot. At this point, the dentist would measure the depth of the canal using a combination of X-rays and specialized equipment. If a dentist fails to measure properly, it could mean that the tooth would be at risk for reinfection. Now we need to clean the canal of the tooth using sodium hypochlorite, commonly known as bleach. We'll let the bleach sit in our patient's tooth for about 5 minutes to make sure that all the bacteria and tissue inside the tooth has been dissolved. Great! Now use the suction to remove the bleach from the patient's tooth. Next, we'll need to fill the tooth using a rubber compound known as gutta percha. Gutta percha is often preformed as tiny, thin cones that we'll insert into the clean canal of the tooth. I've already added some sealant to the gutta percha cone. Looking good. A heated instrument is now used to remove the excess gutta percha. Pack the gutta percha into the tooth canal using a plugger. After the gutta percha has been placed, it is common after a root, and that's a root canal. Why not check out some of our other amazing surgeries here on surgerysquad.com.
O zaman izlediğiniz için teşekkürler. Hoşça kalın. Bay bay.